So how many times have you sat in a crowded emergency room, uncomfortably waiting to be seen? Well, now there's a new option, an upscale alternative called Modern Emergent Care. And Dr. Ray Gutierrez is joining me now to talk about his new Sandy Springs location. Welcome.
Hi, thank you.
So, Dr. Gutierrez, how did you come up with this business model?
This is something God put in my heart a couple of years ago. It's as an ER doc working in the ER, I see the benefits to the ER, but we also see some of the deficiencies. And my partners and I wanted to be part of the solution. So
how is Modern Emergent Care different than a typical ER?
Being a private upscale facility, we actually take reservations. Patients can come and be seen pretty much within 20 minutes of arrival. We have our own CAT scans and labs and all the facilities that we require in the ER, so most patients are in and out within 2 hours.
Wow.
Yeah.
And you can get lab results the same day?
Yep. CAT scans, labs, x-rays, ultrasound, pretty much everything the ER can do.
So when you think about concierge services, you normally think that that's reserved for the rich and famous, but that's not the case with Modern Emergent Care.
Right. It's a standard package.
Fantastic. And your facility is gorgeous. It literally looks like a spa. Tell me about some of the features.
Well, I think what happened working in the ER for as many years as we have, it's kind of cold, it's sterile, sometimes uncomfortable, sometimes even scary. And so we wanted to change the perception. We wanted it to be warm, inviting, comforting, clean. And so we thought of a spa, and we're trying to bring those elements into it. So you have like leather recliners, marble floors, things like that. It's a nice place.
And you can make reservations. You even have a private entrance.
Right, right. If someone wants additional confidentiality, they can call up and reserve the room and says, I'd like to come in. If we have enough information and people pre-register, they can actually go right into the room, bypassing the lobby.
Wow. So tell me about some of the treatments that are offered there, some of the procedures that you can have done.
We can take care of pretty much everything. We can do kidney stones, we can do conscious sedation. Someone dislocated the shoulder, we put them to sleep, they wake up and it's back in place. We can do the stuff the urgent care centers do. If you need to be in the hospital, we can get you admitted to the hospital. You know, we can deliver babies. We don't want to, we're not suggesting to do that, but if somebody comes in, you know, we always, if someone calls us up and says, I think I'm having a baby, so go to the ER. But if you come in and you have one, we can take care of that too.
You can take care of that too. And what about your staff?
We have, myself included, 6 board-certified ER-trained docs. Total, we have about 50 years of combined ER experience. We have ER nurses. Everything you have in the ER, we have there.
So this is really changing the entire patient experience.
Yeah. Emergent care centers like us it's a new trend. It's been out for about, it's starting to pick up in the last 3 years. In the last 3 years, probably about 17 places have opened up like ours. Actually, first one in Atlanta. There might be another one in Georgia. I'm not sure.
Wow. So looking ahead to the future, this really is the new face of emergency care.
Oh yeah. I think in the next 10 years, you're going to find a lot more. I think it's people want better. People want value. People want to be made to feel important, and they are.
And tell me a little bit about the cost, the affordability.
We're typically a fraction of the cost of the ERs. We're ideal for patients that have high deductibles, or for people that are in between insurance. We're ideal for those guys. We're the best value, bar none. For people that have method deductibles, we're still a good value. And the reason we're able to provide that value is we're not open 24 hours a day. We're open 12 hours a day. We're eventually going to get to 14 hours a day. And so a large percentage of the hours that are non-productive in the hospital still has to staff it, and that's where they lose. And then most of our patients are actually paying the bill. So because most of them are actually paying the bill, we don't have to overcharge the people who do.
Well, congratulations on such a phenomenal business model. And where can people go to find you?
We're right across here from the Prado, 5505 Roswell Road. But you can find out more information on the website, modernemergentcare.com.
Dr. Ray Gutierrez, thank you so much.
Thank you. Thank you.
And for more information on Modern Emergent Care, you can also log on to our website, atlantapluggedin.com.